Let me introduce the next presenter. This is also a fairly important topic where the empowerment, we spoke about the empowerment in the morning regarding nurses, and the topic is on clinical teaching in nursing on a learner management system. Let me introduce Mr. Tharidu Dushyanthya. He is the head of clinical skills department of International Institute of Health Sciences, Sri Lanka. Tharidu is a graduate nurse and is a master trainer of Australia, and is qualified in aged care services as well. And he is an expert on Moodle development. He has single-handedly managed the Moodle, total Moodle on which is built on IIHS. Tharidu Dushyanthya.
Thank you, sir. Well, if I tell you that nursing clinical skills can be assessed through a learner management system by recording them and by assessing distally, so there'll be a lot of doubts. Now, there is a challenging topic in a context where the technology is minimally accepted and technology is doubted. So, well, it's about clinical skills assessment in nursing on a learner management system. So, well, now we have a system which perfectly runs, but why we should assess clinical skills of nursing students on a learner management system? The reason is, well, like, we talk about international standards. We try to go in par with international standards, global standards, but in terms of development of knowledge and skills of clinical preceptors and clinical instructors, how confident are we to say that we are up to standard, to say we know the cutting edge technology where the world is using? So, well, this is about being with international standards. So, well, the system is convenient. So, where if I want to get assessed by an expertise from somewhere else, distally in the world, so maybe an Australian expert, or maybe a US expert, or maybe UK expert, so I can do it. So that is convenience. So it's economical. For an assessment, we can get down clinical experts into the local centers, but with this system, you don't have to. And distance, which is a major problem where, like, nursing education faced where, like, not having been able to get involved much human resources or experts. So distance will not be a problem with this methodology. And the experts involvement. Now, as I told you, if I want to make my students global professionals, or if I really want to make my student capable of handling international challenges, if I want to make my student go and work in another country, in a completely different culture, in a context with cutting-edge technologies, so I can do it. So experts involvement. So, well, the types of assessment. Now, well, when it comes to education, you have two main types of assessments. One is formative assessment, which is continuous. So you do an instructional unit and you just assess the student and give them a feedback. You don't wait until you complete the instructional unit. The second one is summative assessment, where the student will be assessed at the end of the course or the program. So, well, now I have developed this method to conduct formative assessment, but this also can be used for summative assessments. Well, what to assess? When it comes to clinical skills, it's not like any other stream or area that we assess. We have three elements to assess. So, knowledge, attitude, and skills. So, when you say nursing clinical skills assessment, not only looking at these individual elements, but exactly what we should assess is where this red circle shows you. where these skills, attitudes and knowledge overlaps. So that is quite challenging to do using technology and learner management systems. So well, the method, students were provided with case scenarios. Why case scenarios? That because we need to assess students' ability to adapt their knowledge and attitude into practice. So secondly, the students were requested to carry out procedures in front of a camera under the predefined settings and requested to take photographs of required evidence of documentation. It's not just doing the procedure and finishing it off, but also documentation plays a major role. Progress notes, MARs, so where these photographs are taken and uploaded in order to assess their ability to complete documentation or the competency to keep records. So, well then, students were requested to upload video clip on YouTube channel with respective privacy settings as unlisted video clips. So why YouTube? That because not to overload the learner management system or the server. So, and then students supposed to submit the link of that YouTube clip along with photos that he or she has taken on learner management system. Basically, the learner management system that we use is a Moodle-based platform. So, after that, students supposed to carry out the respective quiz, which will be listed under the assessment. So, we'll be using this quiz to assess the knowledge component of this student, to assess knowledge and attitude further. So, well, then what happens? Now, anyone from anywhere in the world with the authentication to access this can assess these skills, provide feedback, share their thoughts, new technologies, standards, make students ready to be a global professional. So students who get assessed with experts from different parts of the world will be better ready to be a global professional. So they get inputs from everywhere. So well, now these are predefined settings for the recording. So students supposed to record the video clip at a light level of minimum 500 lux. So like that's too technical, is it? So student can download simple mobile application which can use to measure light levels. I know they are not accurate, but yet this 500 lux, which is approximate when you check with a mobile phone, that is more than enough for us to get a clear video clip. So, well, sound level, students' conversation should be an injection procedure. You need to particularly look at the needle size, the angle that student use, the hand techniques, whether they use muscle bunching, nose track technique. So for that, we will be defining camera angle and the height. So you will be able to see that later. Now this is a picture that we have provided for students to maintain or to set up the camera, the angle and the like height. Presence of an invigilator. Now we need an invigilator. We need an invigilator there just to make sure students won't cheat, students won't edit their video clips, so students won't get support from surrounded people, because this is going to be an assessment. So can be graded or non-graded. So well, now these are few photographs of the learning management system. So this is where student will be getting the instructions about the video clip. And this is an attachment which shows where exactly the camera should be located. This is for bed making procedure. So this is where students are supposed to submit their link and photographs. Now this is what actually assessor can see. Now that's clear enough for us to assess students' skills of bed making procedure. So this is where the assessor can grade the student or give their feedback. And this is an IM subcutaneous injection. And this is document evidence of an MAR or maybe progress note or whatever the documentation that students are supposed to maintain after the procedure. Methodology. Now, this research was conducted as a qualitative ethnographic study, and the population were clinical preceptors, both local and international. And the sample is purposely selected until a theoretical saturation point reached. And the data collection was done as in-depth interviews on Skype on the negative point of the examination method. So analysis was a thematic analysis. These were results that I found. The first theme was technical challenges in evaluation. Like they used to say, like sometimes I couldn't hear what students say clearly, and sometimes they say like it's better like if you zoom the video clip when it comes to injection procedures. And the next one was lack of confidence in the assessment of fine skills. Now this says it's good if they verbalize the procedure with the rationale. How do you measure communication skills? Now well, for this we have given them a case scenario where students are supposed to choose the best injection site according to the scenario that they have been given. But still I found we're a little in confidence about the methodology that we used. And loss of personal touch. Now usually as assessors, we prefer to be with the student and like give the feedback then and there. So they question that. And lack of confidence in the safety of the exam and the system. Like, are you sure that they didn't cheat? Discussion. Well, the system was able to provide a platform where assessor can assess clinical skills. The grading and providing feedback about the student and performance could be done using the system. And use of system will allow taking experts into into place of assessment. And these were the negative points identified during the assessment. So technical challenges, lack of confidence in the assessment of fine skills, use of lack of personal touch during the evaluation, lack of confidence about the safety and the system of the exam. Major issue among assessors was lack of confidence about the system, even they agreed that they can assess skills using the system. Yet they showed positive attitude towards introducing the system, so where local students can be assessed by experts around the globe. So recommendations. Well, recommended settings should be revised, especially the sound levels. 60 decibels with surround sounds like noisy in a noisy environment was not very clear. So that has to be revised. And students should be well trained or invigilator should be well trained to handle these technical equipment, especially when it comes to a graded examination. Like having student to arrange these things will be an added stress. So by using appropriate case scenarios, student having to explain the rationale or each action can be avoided. And by providing set of questions related to the procedure and having invigilator to ask them will prevent student having to do the quiz, and like the assessors will be more happy so they can assess communication skills. And by encouraging student to communicate with the client during the procedure will allow assessors to assess their communication skills. And having students to describe the case scenario in front of the camera at the beginning will make assessors aware of the case that they are handling, so they will become more confident about the system. And maybe they will not have questions about using or choosing the appropriate injection site. So, well, these are my references. And thank you very much.